Hello everyone, you're watching PhysioClassroom channel, and in today's video we are going to practically demonstrate some of the important exercises based on BRUNNSTROM therapy concept that can be utilized by a physiotherapist to retrain pronation and supination movements in a stroke or a hemiplegic patient. Now, when a stroke patient is still in the stage 3 of hemiplegia recovery, the supination movement is only possible with the elbow flexion movements, and the pronation movement is only possible with the elbow extension movement. This is because of the strong linkage between these movements of the flexor and extensor synergy. Therefore, if one has to test the stroke patient's voluntary control over the forearm pronation and supination movement, then the elbow should be first brought near to the trunk in the adducted position, and then the patient should be asked to perform these movements. What we are going to see is that in stage 3, the patient will only be able to perform the supination movement because the elbow is flexed. Pronation movement will only be possible once the elbow is moved away from the trunk. Therefore, the first exercise strategy that should be utilized by the physiotherapist is to break this strong linkage between the forearm pronation and elbow extension movement to develop actual or voluntary forearm pronation. So now the exercise planning will involve to keep the patient's forearm in a pronated position and then taking the upper limb in the extensor synergy pattern while maintaining slight flexion in the elbow joint. And now from this position, the therapist is going to give command to the patient, push your hand forward. Now this movement of pushing forward is going to be resisted by the therapist in such a manner that the elbow does not extend fully. And at the same time, the therapist is going to give another command to the patient, don't let me turn your palm up. So now the therapist is asking for two things. One is to keep pushing, and the other one is to keep the palm down and don't let the therapist turn it up. Now, since pushing involves the elbow extension movement and forearm pronation is strongly linked with the elbow extensors, therefore the patient is expected now that he or she can resist the supination movement that is being given by the therapist, and as a result isometric to eccentric contraction is going to happen in the pronator muscles. Now the important thing that needs to be noted here is that initially the therapist was resisting the pushing movement, and now the patient's attention has been drawn towards resisting the supination movement. So now the patient is fully conscious about keeping the forearm pronated. At this moment, the therapist should reduce the direction of resistance that was being given towards the pushing movement and only concentrates on supinating the forearm. So now once the eccentric contraction starts setting in the forearm pronators and the forearm reaches in a mid-prone position, the therapist should again ask the patient to turn the palm down again. Now this procedure needs to be repeated again and again while gradually increasing the amount of elbow flexion movement. So gradually the patient is going to be somewhere here and patient will be asked to push and at the same time resist the supination movement. So now the patient has developed this ability to pronate the forearm while keeping the elbow semi-flexed. And the patient now will be able to pronate and supinate the forearm in this position, which indicates the successful breakage of the strong linkage that existed between the elbow extensors and forearm pronators. And this also signifies that the patient has now progressed into the stage 4 of hemiplegia recovery. Now it is important to note that these are just the exercise strategies that we are discussing. The therapist should also incorporate the functional or the task-oriented training while designing exercises for the patient to make it more interesting and result-oriented. Gradually, more and more complex movements should be included in the exercise, and the patient should now be expected to perform the forearm pronation and supination movements at varying degree of shoulder movements with respect to the trunk. Other treatment strategies that are needed to be utilized by the therapist to gain voluntary control over the pronation and supination movements are use of hold after positioning technique, training in small ranges, and utilizing all three types of muscle contraction. These all were discussed in detail in our previous videos of BRUNNSTROM therapy concept. Similarly, exercise strategies are needed to be designed to break the strong linkage that exists between the elbow flexor movements and forearm supination. So now again the starting preparation would be to keep the patient in the mid range of the flexor synergy and then asking the patient not letting the arm be pushed downwards. So once the patient starts recruiting all the muscles of the flexor synergy component in order to prevent it from being pushed down, the therapist is now next going to resist the forearm supination movement, is going to ask the patient, don't let me turn your palm down. So now all the focus of the patient is going to get shifted in keeping the forearm in supinated position. Gradually, more and more elbow extension movement will be included and the exercise will be repeated until the patient will be able to produce the supination movement while keeping the elbow extended. So these were some of the exercise strategies that can be utilized to retrain forearm pronation and supination movement in a hemiplegia patient. I sincerely hope that the information shared in this video is going to be helpful for you all. Do keep motivating us with your comments and feedback. See you all in our next video. Till then, keep learning, keep sharing, and stay connected.